Hello everyone, welcome to the IJD Podcast. We're the official journal of the International Society of Dermatology. I am Lily Becke.
And I am Anita Biro. We are the editorial managers of the IJD. In this podcast series, we'll spotlight the dedicated professionals who help shape our journal, including section editors, selected reviewers, and authors.
Stay tuned for a closer look at the people behind IJD.
Hi everyone. In this IJD podcast episode, my guest is Professor Zsuzsanna Bata, Deputy Editor of the International Journal of Dermatology. She will share her thoughts about the journal and about clinical dermatology. But first, let me introduce you Zsuzsanna Bata briefly. Zsuzsanna Bata Csörgő received her medical diploma at the Albert Szent-Györgyi Medical University in Szeged. She started her residency at the Dermatology department in the same university, and in 1990, she moved to the US and worked in the research lab at Kevin Cooper in Ann Arbor, Michigan, for 8 years. Her research focused on the pathogenesis of psoriasis. She then returned to Szeged, continued her research, but also participated in the clinical care and teaching. In 2000, she became the specialist in allergy and clinical immunology, and her clinical work involves patients mostly with immune-mediated skin diseases. Since 2006, she is a full professor at the University of Szeged. During her career, she successfully applied for different research grants and received professional awards for her work as a physician and a researcher. She has more than 180 scientific publications with more than 5,000 citations. Professor Bata actively participates in professional organizations, such as being the president of the Hungarian Dermatological Society and the board member of the ESDR. So, hey, Zsuzsa, I'm so happy to have you here in our IJD podcast episode. So, you are one of the deputy editors of the journal. What is your motivation to join to the journal and to become the deputy editor?
Well, my motivation was the feeling that the fact that the journal editorial office moved to our clinic, to Szeged, is really such an honorable thing that in a way it is my duty to participate in working for the journal. As a professional clinician, researcher, I have used publications by others. I have learned a lot about my profession by reading journals. So I believe that it is extremely important to have good quality journals. It is very important to publish our experiences, not only on the research part, but also on the clinical part.
Yeah, back to the motivation. Actually, we are colleagues, and you haven't had any other option than to say yes for this request.
No, I wouldn't say that.
Okay.
I did have some option, and I knew that it was not an easy task, but at the same time, I also felt that this is something that you cannot really say no to, because it really is. I consider it an honor to be part of something at that level in my profession.
Yeah, this is a really interesting task. What is the most challenging part of this work?
The most challenging part is always the lack of time, because fortunately, rather, I am still a practicing physician. I am chief physician on one of the wards at the clinic, and I really like working as a physician. There is some research still which are really of my interest, and of course the time is not too much, so for all those things that we would like to do, but if one really needs to, one can manage.
Yeah, this is really difficult to find time to do many different things. We are all involved in different societies, presidents of different some things, and we do have also a lot of things to do in the university. Having seen that this is the most challenging issue, the workload, we, the IJD, introduced the position for junior editors who are paired to a senior editor. And I suppose that this will be a big help and will ease the work of the section editors and the deputy editors. What is your thought on that? Was it a useful initiative, or how does it work in your case?
In my case, this is a very good thing. Of course, it depends on the junior editor, but as it happens, I have a very good junior editor. And since we both are checking the papers, we both are working on a regular basis. And another important thing, which also helps, is that we can discuss papers, which is I believe that I still can learn from my younger.
We all can learn.
From my
Definitely.
younger colleagues.
Yeah.
And of course, that works vice versa. So he can also learn from me. And this is a very good, that was a good idea. It helped me a great deal.
Now, what is your opinion? What were the major breakthrough in dermatology in the last few years?
Well, it's very hard to say. Obviously, the checkpoint inhibitors in melanoma therapy comes to my mind as a first. And also as an immunologist, this is a challenge, and there is much to learn as far as the side effects are concerned with the checkpoint inhibitors. And also on the particular dermatology side, I really regard the chronic spontaneous urticaria therapy a great help, and understanding the pathomechanism behind it, how it works. It has been a great help because there are so many patients who suffer from that condition. And also other parts that with the biological therapies are really their care for the psoriatic patients. The care is much easier. Their life is much easier.
And of course, with the JAK inhibitors, this is everywhere. And
the JAK
JAKs.
inhibitors are everywhere, and they are very helpful. I don't think that they really help that much for the derm diseases, although there are some particular, not too frequent disorders of the skin, but it is to widen the therapeutic option is extremely important. Sometimes it's hard to say which therapy to choose for an individual. So one has to really concentrate on the individual patient.
Yeah, now we have a lot of papers on the overlaps in between atopic eczema and psoriasis, and for these patients, definitely the JAK inhibitors could be taken into consideration. But anyway, going back to the checkpoint inhibitors, we have to face with completely new diseases, because not just provoking an autoimmune disease, but this autoimmune disease is a little bit different, and it is more tricky how to treat these patients with immunosuppressants, and so how do you see this?
My experience is the same, that these autoimmune conditions, I would say conditions that are induced by the checkpoint inhibitors, they don't behave these diseases not exactly the same kind of diseases that we were used to. The other so far in terms of the autoimmunity. We need to learn, and that's a must if you are a physician. If I think about my years in medical school and what we learned at that time, it is really, without learning continuously, is impossible to function as a good physician, really.
Could you tell a few words about your own research field? You started in Ann Arbor with Kevin Cooper and then continued this work in psoriasis. But could you a little bit explain
here at this
for the
clinic,
listeners?
And I also have to mention that our clinic, thanks to you also, to a great deal, we have a research lab and we have young researchers who are continuing the research. I believe that basic research is very important in our field, and I started working on psoriasis, and my main interest has been in the past, I don't know how many years. The basic hypothesis is basically that the non-lesional, the healthy looking skin of the psoriatic patient is not exactly as a normal person's skin, and I have been, and we have been with some of my colleagues, focusing on all those tissue alterations that may may make the non-lesional psoriatic skin prone to develop the lesion.
Yeah, and you had also some papers about the role of basement membrane.
Yes, that's the extracellular matrix alterations, and the basement membrane in the skin is a very crucial part. And there has been, and it's been a long time, that has some people described alterations at the basement membrane in the psoriatic non-lesional tissue, as well as, of course, the lesional is different, because in the lesion you have such a confusing picture with all the immune cells and everything. But even in the non-lesional part of the skin, there has been observations that point to the fact that the basement membrane structure is not exactly normal. And we are trying to focus on that, and fibroblasts and all the tissue environment that really lately it is becoming more pronounced that the immune problems are to a great deal related to the tissue.
Yeah, in Szeged, we are responsible for treating roughly 1.5 million people having skin disease in this area. And sometimes there is a lot of discussion whether do we need inpatient beds or not. We still in Szeged University, we still have 55 beds for inpatients. And on the other hand, if you look around the world, in the US, in UK, you have barely any inpatient beds. What is your thought on that? Do we need really these beds, or what is your feeling?
I definitely feel that the inpatient way is for certain complex, especially autoimmune diseases and immune-mediated diseases, is good to have, because with the participation of other colleagues, there are many patients whose skin condition really relates to some inner organ disease, and not to mention latent infections. And at our clinic there is also we also treat diseases that are related to different viral or bacterial infections. And I think it's important to have people outpatient setup is not enough to figure out really complex diseases.
I completely agree, and it probably depends on what we mean under dermatology, because if we think on the patients you are treating in the ward, there are really severe cases that should be treated somewhere else, maybe not in dermatology department, but somewhere else in internal medicine or emergency or intensive care units. So sometimes we are in the gray zone that these patients should be treated somewhere. Maybe there could be countries when these are treated by the internalists, but traditionally we and probably the German system and the Austrian system is the same, that these very severe patients are treated in our department. So if we are thinking on this very severe skin and soft tissue infections, these are treated by internalists or by surgery departments, but these patients should be treated somewhere. So
yes, I agree.
And for the education, what is your thoughts on education? We are actually dealing with education. We are teaching Hungarian, German, and English-speaking students. And for educational purposes, I think it's also very important to have these patients as an inpatient, hospitalized patient. What is your thought?
I absolutely agree. I think it's in some way it is true that in some places it is a custom that who treats whom, but in our clinic, it has always been, and in fact in Hungary, the inpatient ward, the dermatology ward has been always responsible for more severe conditions such as toxic epidermal necrolysis comes to my mind. And sometimes semi-intensive care is going on the ward. And I think this, for one thing, it makes our specialty much more interesting. And it is a great way to teach students. You can, if you have a ward, you can present live patients to the dermatology residents and also the medical students. And it's not just the 2D computer picture or photograph that you are showing to them.
Yeah, the question is how to teach dermatology, because as we are colleagues, that I hate this 45 minutes face-to-face meetings, lectures, but on the other hand, everything has been changed around us, but how we teach our students is not too many differences in the last 100 years. What is your feeling on that? 45 hours, lectures?
No.
Boring lectures?
Obviously, teaching, university teaching is the best as it started. I don't know how many years ago. 1-to-1, 2-to-1 mentor. And as far as I am concerned, I learned much more during my practical years from the individual patients. Unfortunately, when you have a large group of students to teach, that's another question. And I'm not sure whether I can tell you what would be the best way to teach these people. One thing is sure, that if there is a topic that I have to teach to the medical students, I am able now, without being too high-minded or what, I'm able to tell them which are the most important things that they should learn or should remember. While if I give them a book or a paper, they might not be able to figure out what are among the many information that they get out from that, which would be the most important.
This is something that I always tell our the residents, that the first thing that they have to learn what is important and what is not as important.
And if you are
what is the red flag?
If you don't have any knowledge, then it's not easy.
Moving back to the journal. And about the publication industry. We all are researchers, clinical dermatologists. We want to publish. We all publish. And sometimes it is really very difficult to publish a paper because the reviewing time is too long, and it's not an easy situation. And then, on the other hand, as editor, we struggle with a little different problems because we have to find reviewers, and this is extremely difficult. We have from year to year 10 to 20% more articles in each journals, and then we got invitations in every week to review a lot of papers, and these tons of information. It is extremely difficult to handle. And both for the authors it's difficult because they are expecting rapid review. They are just waiting, and they don't understand what the hell is doing that the journal. And on the other hand, we know that they are expecting the reviews, but we cannot find reviewers. To be a reviewer, it's a really important task for all the academic scientists. But everyone could say, okay, but I don't have enough time. But I need a rapid review. So this is a situation. How do you see this publication industry?
Unfortunately, the way I see it is the basic problem is that it has really become an industry. And an industry works, the basic working ways are different. And too much information is really not always useful. And to find reviewers to reviewing papers is a lot of work. And if every week you've been asked to review 4 or 5 papers now, that's too much. It's impossible to fulfill that.
We have to contact our friends, and then later on our friends, when they get a phone call, they will say, "Oh no."
And if you and another point is what I struggle with is that if I say yes to a review, then I really want to make a good review, and that takes time. Sometimes it's not always easy to say this, and so it is a responsible job, and in an industrial environment, to work for free is not so easy.
What would you suggest for young dermatologists? Why to be involved in research, in publications, reviewing papers? Is it important for them? Or if somebody would say, I just want to be a good clinician and not interested in research, what would be your answer for that?
To publish is very important. You are helped to a great deal when you read other people's publications. And in order to be able to gain that positive influence or effect, you have to pay for it. And your reviewing papers and publishing is a you give back to the scientific community, and that's, I believe, is important. Research is extremely important, but for me, research has always been fun. And if you you can be good at something which you really like. You can regard research, for my point of view, as a hobby. And if you like it very much, then you are willing to work during the weekend and in the evening, and so I would say that in terms of research, but also as a clinician or a practicing physician, it also gives you, if you feel that you are getting better, you are good. I see that in my young colleagues also, how happy they are when they really got the diagnosis right, when their patient is getting much better. So you got so much reward from the patients. Research requires more patience on your part, because to get rewards, it takes a much longer time. But that's how I feel about these things.
I think another issue is that if you are doing some kind of research, maybe laboratory work or clinical research, that you have something that is your own. Of course, it's from a group, but this is your own. And then you can attend a meeting, you present your data as a speaker. It is much better feeling, and then just to sit and to hear what others are talking about. So, Zsuzsanna,
that may also be important.
Yeah. A good feeling. That's a hobby.
That's true. Okay.
So, Zsuzsanna, I would like to thank you very much for being with us today.
You are welcome.
And I hope that you, the listeners, will join us in the next podcast as well. Thank you very much for you all.
Bye.
Bye.